Okay, I don't know what you're seeing. Are you seeing a squirrel?
Yes.
Okay, then we're in the right place. Yeah, I'm Dr. Lander. I have been at Ohio State for almost 20 years now, but my background really goes back to almost 40 years when I started doing counseling in general. One of the things that happened is I was working in a VA hospital, and at that point I had no experience with addictions and no experiences with adolescents. And I had to come back to Columbus to finish my PhD. And when I did that, I was putting out resumes all over the city. And I put probably at least 20, 25 resumes out to places that I was qualified for. And I put in one that I was not qualified for. And that was working with chemically dependent adolescents. So you can imagine which job I got. But it turns out that ended up being what I've discovered is that you either love working with people with addictions or you don't. And I think that's true for medicine and for social workers and everyone. I love them. And actually, cocaine addicts are my favorite people. Uh, this might take a little explanation. But
Please.
well, what I have found is that it's our understanding that is the issue, is really at the issue here. So let me just kind of give you a basic, this is not an official technical definition of addiction, but this is a practical definition. And it starts with the lack of ability to control a behavior. And I do mean lack of ability. People aren't doing this, and it gets to a point where people aren't really doing this through volition. They're doing it because they are compelled to, they have to. They don't want to be in this situation. They do not want to be in this condition where they have to depend on a drug or finding it or the money and all the guilt and everything that comes with it. They don't want any of that, but yet they cannot stop it. The behavior becomes totally compulsive. It causes problems in life functioning, social functioning, health, or well-being. So if it doesn't cause any problems in your life, then it's not really a problem. It involves obsession. And obsession doesn't mean that someone is thinking about alcohol and drugs 24 hours a day, 7 days a week. What it really means is that there are periods of time when they can literally think of nothing else. And disease when unavailable. This is really interesting because one of the most terrifying thoughts and events for an addict is going on vacation with your family, because you have to worry about how you're going to use it, how you're going to hide it, how you're going to get through any kind of customs or border checks or whatever. You know, how are you going to get it if you run out? Do you have enough to make it through? I mean, I have people that are totally panicked when they're getting close to running out of their drugs, when they still have a small supply. So understanding this mindset becomes important, which kind of brings us to this whole thing of the greatest problems that we have when we're working with people with substance abuse disorders is our own beliefs and expectations. It's what we expect them to be able to do, the kind of decisions we expect them to be able to make. That's the problem. So let's kind of go back to basics and start from the beginning. And in order to understand this addiction behavior, we've really got to answer two questions. We have to answer, why do humans do what they do, human behavior? But even more so, we've got to get back to answering the question of what is reality? I know that's pretty heady for this early in the morning, but we're going to do it. But I do want to start with a disclaimer. There are a lot of ways to look at the exact same phenomenon. We can look at something that happens, and we can look at it in terms of molecules. We can look at what happens when this molecule and this molecule come into proximity with each other. We can look at it biologically, and we can say, and we can explain it in terms of neurons and brain structures. Or we can just observe the behavior. What do we see? What do we hear? But if we want to take that a step further, we can ask ourselves the question of what made that behavior happen? Why that? Why'd they say that? Why'd they do that? And we're getting into motivation. And if we want to even go further, we can look at this spiritually in terms of meaning and universality. Now, if we really wanted to go full circle, we could look at this from a subatomic or a quantum level. Now we're bringing in things like time, space, and dimension. And we're definitely not going to do that at this hour of the morning. But the point is that if we start to understand how something works from a biological or even a molecular level, that does not take away the spirituality of it. If we understand the mechanics, this does not negate the existence of God. I want everybody to be clear. I'm not seeing any objections, so here we go. There are three things you need to understand human behavior. First, all behavior comes from my brain. Now that's not rocket science, but what was happening is in the 1940s, they started doing brain surgery on people under local anesthesia. People were awake and alert while they were undergoing brain surgery. They took this opportunity then to map out a human brain. What they would do is they'd take an electrode and put it on or near a place where they were interested in. They'd put a current into it and literally watch what happened or ask the person what they were experiencing. And so they'd put the electrode over here and they see this muscle do this. Say, okay, that controls this muscle. And they'd go into the core of the brain and the person goes, oh, I'm tasting salt. This is all on film and it's very fascinating to watch. But as they mapped out the human brain, we looked at what parts of the brain are responsible for what. And so we break behavior down into a number of different areas. First one is thought. Okay, this is like logic, the ability to take two or more ideas, combine them, create a whole new concept. Judgment, that ability that I have to say, okay, this is good, this is bad, this is right, this is wrong, this is appropriate, this is inappropriate. Prediction is the ability that I have that says, okay, if I do this, this is probably what will happen. Decision-making gets really interesting because we're going to start to see that human beings are very grandiose animals because we think we control everything. We think we decide everything we do, but we don't. We generally don't make a whole lot of decisions in a day. You don't decide how you're going to get into work in the morning. You don't sit in your living room and think, well, how am I going to get there today? Well, you know, I got a car. Oh, I could go by car. There's a bus and that too. You don't do that. You can be so preoccupied. You can drive all the way into work and not remember a thing about it. There's no decisions to be made unless you're driving to work and then there's a tree down in front of you. Now you have a decision to make. Well, am I going to go back up Main Street? Am I going to go home? Am I going to call into the office? What am I going to do? A lot of our lives are basically just based on what's in front of us to do or what we do routinely. Those aren't decisions. And then there's calculation. 1 + 1 is 2, 3 × 3 is 9, and so on. Now, the interesting part about this is that human beings are the only animals that are capable of any of this. I mean, you can teach your dog, hey, Rover, what's 1 and 1, and get it to go woof, woof. That doesn't mean it understands the concept of mathematics. The part of our brain that allows us to do this is the prefrontal cortex, this area right behind our forehead. It is the most advanced part of the brain. It is the most sophisticated part of the brain. And human beings are the only animals that have a developed prefrontal cortex. But when we talk about behavior, thought is not the only thing we're interested in. One of the really fascinating parts about the experiments with electrodes is one point they got down into the core of the brain. They put a current into it and the person just exploded in a rage. I mean, just muscle tension, pupil dilation, just, body temperature, just incredible. And the people are right there with the clipboards and they're saying, well, what are you experiencing? And the person would say, I'm so mad. They go, well, what are you angry about? What's running through your mind right now? And they'd say, I can't think of anything, but man, I just need to break something. When they turned the current off, the person would immediately begin to calm down. Okay, I'm ready to go. So they found a point that triggered rage. They found one that triggered fear, anxiety, panic, terror. They found one that triggered sadness, depression, and they found one that triggered elation. What we know about emotion so far is, first of all, they found trigger points, but actually each of these emotions involves multiple sites of the brain going off at the same time. It's not a single site. They just found the trigger for it. But there are only 4 emotional states that we have. This infinite range of emotion that we experience is some combination of these 4, like 2 parts fear to 1 part sadness, or 3 parts elation and 1 part anger. Now, if you don't believe me that you can get an infinite range of emotion from 4 emotional sites, I want to remind you that you only have 4 taste buds: sweet, sour, salty, bitter. From 4 taste buds, we get almost an infinite range of taste. From 4 emotional centers, we get almost an infinite range of emotion. But the most important point I want to make here is that all of your emotions are located in your brain, and we know where they are. And I hate to break it to you, but love is not in your heart. Love is in your brain, and we know where it is. Nobody really accuses us psychologists of being total romantics, right? Nah, it's all in your head. All voluntary movement comes from my brain. You have a band across your head called the motor cortex. This half of my brain controls this half of the body, and vice versa. The way it works is that the information that compels me to move comes from some part of the brain, depends on which one. It goes to the motor cortex. It sends the appropriate signals down to the proprioceptors behind my ears. It tells me where I am in space. Moves those down to the cerebellar area, which then coordinates those nerve impulses and sends them down to the exact right place at the exact right time. Now, all my peripheral nerves can be intact. You know, my brain is perfectly intact. You cut off this signal, I can't move. All voluntary movement comes from my brain. But then there's memory. Memory is not a singular process. Memory is made up of 3 distinct processes. First, your brain makes a ghost image of all that other activity. We call that immediate recall. So if I were to say to you, okay, the color of the day today is going to be red. And if I ask you, okay, what's the color of the day? And you could tell me that it's red, that's called immediate recall. If your brain decides to hold on to that information, it's going to reform it down into the hippocampal area of your brain and create what's called a short-term memory. So if I come back to you at say 3 o'clock and I say, God, what was the color of the day? And you could tell me that it was red, that's short-term memory. That's very different. If your brain decides it's going to hold on to that information, it's going to take it and form it into an actual hard copy, an RNA-style double helix chain. This is going to become long-term memory. Some of it's permanent, some of it may degrade over time, but it is essentially permanent storage. The interesting thing about long-term memory is you can only make long-term memory while you're asleep. This means if you are not getting enough sleep, you're going to have memory problems, because if you do not have it encoded into long-term memory, by the time you wake up, it's gone. It's kind of like your computer. You know, if you haven't saved it to your hard drive, when you shut it down, you know, it's gone. But here's where I want to focus. All of your senses are in your brain. When I'm doing this, I'm not feeling this with my finger. There's no feeling in my finger. There's no feeling until the impulses that start from here show up approximately here. You have a band across your head called the sensory cortex. Each part of my body, this half of my body is perceived by this half of my brain and vice versa. So when I'm doing this, there's no touch until it shows up approximately here. Yeah, approximately here in my brain. My peripheral nerves can be intact. My brain can be perfectly intact. But if you cut off that signal, I can do this all day and there will be no feeling. But it works the opposite direction. Now, when I was working in the VA, I was working with a lot of Vietnam vets. And they will tell you there's days that they can feel pain in a foot when they don't even have a leg. That's because the reality of the limb is in the brain, not in the limb itself. If I'm feeling pain in a foot, I'm actually feeling pain. It doesn't matter if there is a foot or not. Vision is another really good example, because I don't know if you're aware of this, but you don't see with your eyes. You know where your vision is? Your vision is all the way in the back of your head. This is where your vision is back here. In order for you to see, you have neurons that are stimulated in your eye. It sends impulses that get quartered, turned upside down, and then diffused into this area. There's no flat screens back there. And then your brain creates an image out of it. But your eye can only produce about half the data that it takes to create this image for you. So if your eye can only produce half the data, where's the other half of this picture coming from? Well, what's happening is you are creating it. Your brain is creating it. It's filling in all the gaps. How does it know to do that? It's based on your experience. Let me give you a quick example. Very quickly, what do you see? What is this? What do you see?
E.
Yeah, most of you are going to see an E. That's not an E. That's a broken line. This is what your brain immediately saw. This is what I showed you. Now, if you had come from a culture that did not have this letter in the alphabet, you wouldn't have seen an E. If I'd originally shown it this way, you wouldn't have seen an E. Based on your experience, it drives your actual vision and what you see. When you understand this, you understand that all of reality is in your brain. There is no reality out here. There is a physics out here, that's true, but there is no reality. And everybody's reality is individual to them. It's unique to them. No two people are living in the same reality. When we understand this, we understand how two people can look at the exact same thing and see two different things. The question isn't about why don't we get along? The question is really how do we get along as well as we do, given that we don't exist in the same reality? Okay. All behavior comes from my brain, but here's the second part of this. My brain is chemical. There are no moving parts inside of my brain. There's no hamster wheel. There's no little man with levers and pulleys. Everything my brain does, it works. My cells work exactly the same way as in all animals. What happens is you get molecules moving back and forth across a membrane. And a nerve is like a hollow tube. And so you got this wave going. It's like taking a rope and snapping it. It sends a pulse down it. The cell is end loaded with a chemical. We call them neurotransmitters in general. It can be dopamine, serotonin, norepinephrine, acetylcholine, any number of them. When this pulse gets to it, it pushes this neurotransmitter out into the synapse because nerve cells don't actually touch. There's a gap. There are receptor sites on the other cell that are sensitive to that molecule. When you fill enough of the receptor sites, you change the polarity of the membrane from negative to positive or positive to negative. Once you do that, you send a pulse out back the other way, repels the neurotransmitter back into the synapse where there are uptake pumps that pull it back. Fire, back, fire, back. That's it. An earthworm has exactly one of these connections. Human beings have billions of cells with trillions of connections, but they all work exactly the same way, and it's chemical. So all behavior comes from my brain, and my brain is chemical, but chemistry follows the laws of physics and mathematics. I didn't say suggestions or probabilities. 1 + 1 = 2. It has the properties of 2, it does not have the properties of 12. I can call it 3, it's still going to act like 2. It means if I take this chemical and this chemical and I put them together and they go boom, what's going to happen the next time I put those two chemicals together, given that all the environmental conditions are the same? Boom. But see, I don't want it to go boom anymore. It's messy. It's expensive. I don't have that kind of time. I don't want to have to clean all this up. Boom. It doesn't matter what I want. It's math. All right. We're going to put these three things together, and you are never going to see life the same way again. Remember my disclaimer. Here we go. If all behavior comes from my brain, and my brain is chemical, and chemistry follows the laws of mathematics, therefore, all behavior follows the laws of mathematics. Now, this gives the concept of free will a real kick in the head. You know, I told you human beings are extremely grandiose animals. We think we control everything. But when it comes down to our molecules, we don't control anything. Now, before you get depressed or angry, once you understand this concept, you're going to find this very freeing. When you learn that you are not the master of the universe, this allows you to appreciate, to be, to accept, instead of control and manipulate. Now, based on my past experience, there's a number of people in the audience that doesn't believe me that your brain is mathematical. So what I want you to do right now is, under absolutely no circumstances do I want you to think of a yellow Volkswagen. Now, I'm able to take an idea, a concept, a thought, and I'm able to implant it into your brain. You had to see what it was that you had rejected. By then, I already had it in there. Now, if you don't think advertisers, politicians understand this a lot better than I do. I did my graduate work at Ohio State, but I did my undergraduate work at Purdue University. And when I was there, I took an entire year of what we euphemistically called consumer psychology, which should have been called brainwashing, because the whole point of consumer psychology is to get you to think what I want you to think, make you think that you thought of it to the point where you will defend it. But I'm the one that put it there. If you're going to get really honest with yourself, what you're going to discover is that most of your truths and beliefs were put into you at some point by some charismatic source or circumstance. If you yourself had grown up in a completely different culture with a completely different language, with a completely different religion, you would not have the same truths you hold right now. They understood this in 1939 when they were writing the big book of Alcoholics Anonymous, Bill Wilson. He didn't know this the way I just explained it, but he had a sense. And in step one of Alcoholics Anonymous, we admitted we were powerless over alcohol. And what they're saying is we are powerless over math. Now, you look at having billions of neurons with trillions of connections. And you got to understand that human beings, then your brain then is prone to making errors. So here's an example of an error. If you look at the horizontal lines, they look slanted. If you look at any two lines, you'll see that they're parallel. All the lines are parallel. But your brain's not capable of seeing it that way. Your brain is not necessarily capable of seeing what's truly there. Let me give you another example. I want you on this one. I want you to look at square A and square B. Should be pretty clear. Now, as you look at square A and square B, I want you to understand that those two squares are exactly the same. They're the exact same shade of gray. Now, based on my experience, there's people that don't believe me. So I put up a solid gray bar, and you can see they are indeed the same shade. Now, again, based on my experience, there's a number of you that still don't believe me and think it's a trick. No trick. What I'm doing here is I'm photoshopping out elements. I'm not changing anything. I'm not coloring anything. I am just eliminating. See, your brain is wired to make certain assumptions about shading, color, shape, and it will not even allow you to see what actually is true. I can put this back up. And you know they're the same color, but yet you still can't see it that way. All right, I'm going to shift gears and we're going to come back to this. I want to talk about the reward system. You have a bundle of nerves that runs from the ventral tegmental area to the nucleus accumbens. And there are fibers that then move up to the prefrontal cortex area. Now, when they were doing the experiments with the electrodes, the first part of this pathway they hit was the nucleus accumbens. They turned the current on, and the people started talking about incredible sensations of peace and heaven and floating in nirvana and euphoria. Oh. Well, that was interesting. More interesting is what happened when they turned the current off. Now, everywhere in the brain, when you turn the current off, the brain would go back to a normal state. Here, when they turned the current off, the people got agitated. They were saying things like, just let me feel that one more time. Please, just one more time. You know, I won't tell anybody, and I got money in the bank, and I'm not going to cooperate until you do. I mean, this is on film. This is weird. Which brought up the question to researchers as, well, why is this so different from the rest of the brain? So they did a very famous experiment. They got a bunch of rats. They implanted the electrodes directly into the nucleus accumbens of the rat. The rat was able to move freely around this cage with this electrode sticking out of its head. Inside the cage was this pedal or lever. Every time it pushed on the lever, it got a stimulation. After 30 days, what do you imagine these rats were doing? I'll give you a hint. They weren't pushing the lever anymore because they were dead. This was a 100% result. Every laboratory rat was dead. What it did is it would go over and a push on the lever at a pace of about this. It continued doing this until it literally passed out from exhaustion. When it woke up, ignored food, water, sexual partners. Rats are very social animals. They sleep in piles. These rats wanted nothing to do with the other rats, would immediately go over and start pushing on the bar again. They continued this behavior until they died of a combination of malnutrition, dehydration, and exhaustion. I don't know how familiar you are with rats, but I will tell you they do not die easily. To have them dead of their own behavior within 30 days to override their survival instincts is a remarkable result. As it turns out, I actually found some footage of the actual experiment. Wait, you can't hear that, can you?
No.
Hang on. I'm not sure how to fix that.
Hey, this is Kevin. I know how to fix it. Under the share, you should have an option.
Okay.
And let me see if I can share something here to just, I don't have that on. Anyway, you'll see something about audio down there. So when you open it up, you'll see it down in the bottom left, I think. And then you can play it. There you go.
Okay, let's try this. Start over again.
Then one time he...
Okay. Hang on. Let me try it again. I did see what you were talking about. Okay.
Working in Montreal in the 1950s, James Olds devised a crucial test. He worked out a new way to, in effect, ask animals how they felt.
Yeah,
This is a device which
It's playing.
we can hear on the stimulus
Really?
for himself.
Yep.
Okay, good.
Here you notice the animal wandering toward the pedal. When he first touches it, he gets no stimulation. It's not connected yet. Then one time he touches the pedal, it does turn on the stimulation. You can see the lights go on.
Now, the interesting thing about the old stimulation, the rewarding stimulation, was the strength of it. It was somewhat different than rewarding stimulation for food and water in that there was no satiation. Animals would continue for hours and hours and didn't seem to satiate. They didn't feel full. They would just keep doing it for long, long periods of time. They would do it to exhaustion.
Now, I will electrify the grid. the animal must cross an area that gives a very painful shock to the feet in order to get to the pedal and stimulate the brain.
And a rat wanting brain stimulation would brave a shock stronger than even a starving rat would brave to get food.
This shows a rat is willing to pay a very high price in order to get to the pedal.
Human addicts will pay just as high a price for their reward.
So in the second half of this experiment, they put in an obstacle. The rat had to actually cross this painful electrified grid to get to the pedal and push it and get the stimulation. In order to get it again, it had to cross back over, reset, and come back. And it continued to do this. It took incredible amounts of punishment and continued to do the same behavior. And as he said, even if it was starving, he wouldn't do that for food. So this brought up the question of why do we have something in our brains that's that self-destructive, that dangerous to us? And so another group of research got a bunch of rats, they implanted the electrodes again. This time, instead of using them to stimulate, they use them to measure. They're watching the rat's behavior and say, well, what is the rat doing that naturally stimulates this part of the brain? They found out it goes off in 3 primary conditions. When the animal eats, and the more hungry it is when it gets food, the stronger the response. So if it's really hungry and gets the food, it gets this big response. Just a little hungry just gets a little response. The more thirsty or dehydrated it was when it got water, the stronger the response. And at the point of orgasm or little rat climax, whatever you want to call it in a rat, that was the strongest response of the 3. Now we know exactly why it's there. You've got to go to the brain of a squirrel. Any animal, but say a rodent like a squirrel. A squirrel does not have a developed prefrontal cortex. It can't possibly understand the concept of nutrition or the connection between eating and health. So what makes the animal eat? It's really simple. A baby squirrel is born, it's born with a sucking reflex, it finds some mother's teat, it gets milk, and the reward pathway goes off. It's not drinking milk because it understands that it builds strong bodies 12 ways. It's drinking the milk for one reason, and one reason only, is because it feels good. This essentially brings us to the basic principle of animal motivation, which if it feels good, it must be critical to my survival. And if it's critical to my survival, it's something that has to be repeated. There has to be the drive to repeat that behavior. If not, if the animal doesn't eat, it dies, or doesn't drink, it dies, or it doesn't have sex, the whole species dies. We've got no more squirrels. So this drive state that we develop in this pleasure principle works relatively well if you happen to live in the oceans or the forests or the jungles or the mountains. Doesn't work quite so well for human beings, as we're about to find out. So let's talk about alcohol and drugs finally. Because my well-being and how well my reality is interacting with the physics is really dependent on how well this thing is functioning. It has to be very well protected, and it is. It's encased in a very heavy bone called the skull. There's a fluid layer between my skull and my brain that protects it from shocks, so I don't hurt myself every time I do this, which around here is really common. But more important, my brain is protected by what's called the blood-brain barrier. Very few molecules can pass from the blood supply into the brain itself. Now, why is that so important? It's because if I can get another molecule to cross into the brain, I'm going to change the chemistry of it, which means I'm going to change the mathematics of it. So 1 + 1 = 2. 1 + 1 + 1 now equals 3, no longer has the properties of 2. It means if I take this chemical and I put them together and they go boom. But this time I take this chemical, I add this chemical. Now I add this chemical, it doesn't go boom anymore.
Thank you.
Change. Very few molecules cross this blood-brain barrier, but certain ones do. Alcohol, opiates, THC, benzodiazepines, amphetamines, cocaine, nitrates. What they have in common is the ability to cross through this blood-brain barrier, which changes the chemistry in the brain, which then changes the person's reality. Let's take a practical example of how this works. If we all took a drink or a toke or a shot or something, we look at what happens to logic and judgment, like what's a good idea and a bad idea, what I should say to whom, how late I should stay out, how much money I should spend. And prediction, that no one's going to worry about that. And the brilliant decisions that we make when we're intoxicated. But here's what's important. You go up, you're at a party. There's someone who's obviously intoxicated, car keys in their hands, heading to the car. Come up to him, you say, look, Joe, I'll give you a ride home. I'll bring you back in the morning, get your car. What does Joe say? I'm all right, I can drive. Is Joe lying to you, or is this what Joe believes? See, this is what Joe believes because Joe is looking at this. Everyone else in the room is looking at this. I cannot convince Joe he's too intoxicated to drive any more than I can convince you sitting here right now that that's two. Maybe if I browbeat you enough, you can say, okay, Duck, it's two, can we go now? But it is not what you believe. If this were true, Joe's behavior would make perfect sense. I mean, if you're getting ready to leave out of wherever you are today and three people come up to you and try to take your car keys away from you, you'd be pissed too. So in Joe's mind, he's making perfect sense. It is his reality that's telling him that. And whenever you're high intoxicated, you always believe you're functioning better than you are. This is important. You always think you're functioning well, or at least better than you are. That's just the nature of it. Now you can set off an emotion with an electrode, but we can certainly do it with a chemical. You take a drink, that rage part of your brain goes off, your prefrontal cortex, which is the reasoning part of your brain, shuts down, the fight part of your fight-flight system goes crazy, your parasympathetic nervous system lights up, and all of a sudden you become the Incredible Hulk. Oh, smash. What are you going to do with all that rage that came out? Well, you're going to get a fight with a guy across the room. You're going to scream at your wife. You're going to slap your kid. You're going to punch a wall. You've got to discharge that energy somehow. And was that anger triggered by logical, rational thinking? No. So these strong emotional states like rage or anxiety, and if the anxiety and terror gets if that part of your brain gets too stimulated, you start becoming paranoid. You start thinking people are watching you and they're out to get you, or just tapping your phone. If sadness part of your brain goes off, you are going to not go to work, not go to school, lie in bed, stare at the TV, starve yourself, binge eat, but you're not going anywhere until your brain lets you back up again. And elation is essentially what people are shooting for. We do these drugs to feel like everything's okay, even when they're not okay, but it feels like it. But if I cannot feel my sense of alarm, my emotional sense of alarm, I do not have the motivation to change anything in my life. I can be aware that my whole life is falling apart, but I don't have the drive to change it. My senses can be off, movements can be off more or less, but I want to come back to memory because this is another major point when we're trying to understand addictions. This process of taking immediate recall, converting it to short-term memory, and then converting that to long-term memory, those are all chemical processes. If you start messing with the chemistry, your memory is going to start making mistakes. This process can get so screwed up. You can be walking, talking, moving, and have absolutely no memory of it the next day. This is called a blackout. A blackout is the chemical failure of your brain to convert immediate recall into short-term memory. That memory does not exist. And is your brain memorizing reality, or is it remembering the distortions? The truth is it's memorizing the distortions, and it's not even doing that right. One of the things that I have to work with my patients on is the grieving process when they finally understand this whole period of time that they've been drinking and using, their life did not happen the way they remember it because they weren't there, and their memories are all in the direction of, well, it wasn't that bad. I can drive. It wasn't that bad. This is how they remember it. This is how they see it. So they think their family is exaggerating, and they just don't see it the same way. And when we look at the effects of these different molecules, one of the things they have in common is they strike the reward pathway. They light up the reward pathway. What do we know about anything that stimulates the reward pathway? It sets up a drive to repeat the behavior, a survival drive to repeat that behavior. It's not logical, it's not rational. It's no more logical than hunger. It's just a drive state that occurs. Alcohol is the outlier. Alcohol does not directly stimulate the reward pathway. However, in 1 out of 10 people, the way their brains process the alcohol, it creates a byproduct that does stimulate the reward pathway. So 9 out of 10 people that take a drink, it's a drink. But for 1 out of 10 people, when they take a drink, there's just this little bit of, a little feeling of relief that comes. That's your alcoholic. From what we know is in order to be alcoholic, per se, it is a genetic process. If you look at any alcoholic, you will almost always find another alcoholic in the family tree, because that process, whether you break it down one way or the other, is genetically determined. One thing about genes, I don't know how much you know, there are 2 types of genes that we have. We have expressed genes like height and hair color, but we have a whole nother set of genes called unexpressed genes. They don't get activated until they're called on. These kind of genes are the alcohol genes, so to speak, are those kind. If you don't drink, you never turn them on. Once you've turned it on, there's no way to turn it off. Once it's lit up, there are a lot of different depressions that come from trauma that are due to these unexpressed genes that get turned on even in childhood, giving a lifelong problem. But what happens when you take your brain chemistry and you put it in, take it out of order? You mess it up. Well, you follow the law of no free lunch. It's going to cost you if you do that. So let's look on the far left. You can see a serotonin cell would be located in my prefrontal cortex. You do a behavior that releases the serotonin in the synapse, like someone gives you a big hug. You can feel the sun in your face in the morning. Serotonin gets released in the synapse. It fills enough of the receptor sites to change the polarity of the membrane, fires a signal off, propels the neurotransmitter back out of the synapse. A intake pump pulls it back in, fire back, fire back. That's how it works. Now, if I do ecstasy or methamphetamine or alcohol in some cases, I don't do a behavior that releases the serotonin. It gets pulled out, and it gets pulled out in 10 times the quantity that normally would be released, so that you get an instant fill, fire response, a release. But the other thing the drug does is it blocks the uptake pump. There is nowhere for this neurotransmitter to go, so it's just fill, fire, 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 fire. You're not getting high off the drug. You're getting high off of your serotonin. And your serotonin is a system that's telling you you're doing something good for yourself. That's why it feels so good. That's why it feels so natural. It's not the drug that's making you high, it's the serotonin that is. But you got fluids that are flushing this out, you got enzymes that are breaking this down, so that when I'm done using, I don't have enough serotonin to drive this system, as you see on the right there. Now, if my brain calls for a serotonin release and I don't have enough serotonin, I'm going to find this really irritating. It's going to be like, don't touch me and get that sun out of my eyes. If my brain calls for serotonin release and I don't have enough, I'm going to feel irritable. Now, how long does it take for your brain to recover? You have to understand brain chemistry. Let's look at a longer term example. This is a prefrontal cortex slide that's stained for serotonin. So on the left, you can see how much serotonin is supposed to be there. Now we're looking at someone we would call a raver, someone who used ecstasy on weekends consistently, probably for a number of years. 2 weeks after they've stopped, this is how much serotonin is available to this area of the brain. 7 years later, it's still not caught up. Now, the belief is it will still catch up. There was supposed to be a 10-year study. We figured they either lost funding or something happened and never came out. But they were still seeing improvement. But look how long this is taking to recover, for the brain to recover. Take another example. Now we're looking at a brain scan, and we're looking at 3 different levels. The light area is high activity, the dark area is low activity. If we give this person crack cocaine on a Friday night, 10 days later, this is how the brain's functioning. Now, if you work with crack addicts, one of the things you see is that within 3 days, their speech coordination comes back. So they look good, sound good, and this is how they're thinking and making decisions. This is 100 days, more than 3 months after one good crack cocaine use. This is kind of like taking a ball bat and hitting yourself in the head with it. You know, you think, oh, it's just everything comes back. It doesn't. It takes time for your brain to rebalance itself chemically. Let's take another example. This is a normal brain scan. This is someone who's been drinking heavily for 25 years. What you see in the whole black area that you see on the right, those are dead brain cells. Now, you are born with essentially all the brain cells you're ever going to have. The reason your brain gets bigger is not because you're growing more cells, it's because the cells you have are getting richer in their connections. You know, they're getting bigger, essentially. Once a brain cell's dead, it's essentially dead. Your brain will try to make new connections to pick up the slack. But here's another point that I have to make with my patients. After a certain age, these neurons start to prune back. You know, they stop their heavy growth and they start to prune back to some extent. If your brain has already been heavily affected by alcohol and you've got a lot of damage, we see a lot of early onset dementia among patients, even if they have been sober for a while. Now, there's a way around that and things we can do to help, which we'll get to in the second part of this. But it's still something to be very cautious of. Now, this is a SPECT scan. In a SPECT scan, a healthy brain is depicted by a smooth pattern. This is the pattern of someone who's been using opiates for 7 years. It doesn't matter whether they're using street heroin or they're using oxycodone or hydrocodone that was given to them by their doctor for legitimate medical reasons. It doesn't make any difference. An opiate's an opiate. Now, this is not damage. This is energy. After 25 years, and we have people that have been prescribed opiates, like back injuries and so on, for 30 years, this is how the brain's function. Let's look at marijuana, the safe drug. The line on the top is a brain scan of an undergraduate student. They gave this student marijuana and then did another brain scan. And what you see is the brain has gone blue. The more blue and the darker the brain shows, the less energy it's giving off. If we want to look at that in terms of the SPECT scan, this is how the brain's looking. Now, for most individuals, this is not a problem once in a while. When we're talking about recovery, this becomes a big problem. Let's put it into another context. Let's look at it from a different angle. Now, there are people that are born with low serotonin levels. It's not because they've been drinking and using ecstasy. It's they are born with low serotonin. We have a clinical term for these folks. We call them depressed. It's a clinical depression, low serotonin, clinical depression. Okay, so my serotonin level is low because I'm clinically depressed. My serotonin level is low because I've been using meth. What's the difference? Mathematically, what's the difference? There is none. Low serotonin is low serotonin. If we look at all the major psychiatric disorders, they're all due to unbalanced brain chemistry. Not enough serotonin is depression. It's also anorexia. Too much dopamine is schizophrenia. Too much norepinephrine is a generalized anxiety disorder. Not enough norepinephrine is a depression that looks exactly like the serotonin one, but it responds to different medications. You have high glutamate levels, you have a condition called obsessive compulsive disorder because you cannot let go of a thought. If you have relatively high levels of glutamate and you get into a traumatic situation, you develop post-traumatic stress disorder. And if your GABA levels are low, you have anxiety and panic. So unbalanced brain chemistry is a mental illness. When I drink and use it for a significant period of time afterwards, I have unbalanced brain chemistry. What does this tell us? It tells us when you're drinking and using it for a significant period of time afterwards, you are not functioning any better than any mental patient out there. But we have different expectations. You never go up to a schizophrenic and say, just stop hallucinating. Just cut that out. Just be strong. We go up to addicts and alcoholics all the time and just say, just stop drinking, stop that. And we expect them to be able to do that. 1939, Bill Wilson, 12 Steps to Alcoholics Anonymous, somehow had a knowledge of this and understanding of this. Step 2 was to restore us to sanity. That was so much truer than they understood. They really had it. And I'll tell you, it does help. And I say this with love. I'm not saying this in any kind of demeaning way. If you're looking at someone who's actively using it for a period of time afterwards, you're looking at someone who's brain damaged and psychiatrically impaired. If you treat them as someone who's brain damaged and psychiatrically impaired, you're going to be successful. If you don't, you're going to be frustrated. So how do you get to be addicted? I know I'm running low on time. This is really about a 6-hour talk that I'm condensing, so I'll try to keep it going. There are 2 major things that determine how your brain is structured and wired and chemically balanced as you sit here right now. One is DNA. You're born with a DNA blueprint of how your brain is supposed to be wired, and your brain will start to wire itself accordingly. But that's only half the story. Human beings have extremely adaptable brains. So your environment plays a major factor in how your brain wires itself. Let me give you an analogy here. Let's say I'm born with an identical twin brother. We get separated at birth. I end up growing up in Costa Rica. So I've got to deal with light, and color, and accents, heat. My brother ends up growing up in northern Greenland. It's cold, it's flat, it's colorless, it's dark. We have the same DNA, but the longer we are in our environments, the more different our brains physically become. Your brain has a lot of ways of adapting to its environment. The 2 probably most prominent ways is this process called downregulation, where what you see is actual changes, a pruning back of the receptor sites that changes the sensitivity of the cell to the neurotransmitter. But probably more importantly, your brain will disconnect nerve cells and connect them to other nerve cells and build new networks in order to help you do whatever it is that you need to be doing on a regular basis. If you've ever picked up a new sport, a new hobby, a new instrument, a new language, it's really awkward at first. You have to think your way through it. But as these connections get built, you don't have to think about it anymore. In fact, thinking about it oftentimes interferes with it. Anybody who plays golf knows this very well. You let your body do it, your brain take care of the swing. If you start thinking about it, you're in trouble. Now, when I put a drug in my system consistently, my brain will at some point decide this is a new environment, and this adaptation process occurs. One of the areas that's really being affected by this is the reward pathway. It's essentially getting rewired and re-engineered to the point where it now adds the drug to the same categories as food, water, and sex. This has incredible pressure and influence on my thinking and behavior. We'll talk more about this in the second part. But see, anything that stimulates this reward pathway can actually set up the same type of compulsive behavior. We talk about what we call process addiction, because for some people, certain behaviors release an excessive amount of endorphins, which is your brain's natural morphine that gets released when you hurt yourself so you can keep going, for instance. And if your brain releases an abnormal amount when you eat, so you can, maybe it's overeating, you can get it from undereating, smoking, sex, excessive exercise releases a lot of endorphins, gambling, spending. There's a lot of different addictions that can occur from producing too much endorphins through a particular behavior, and you become somewhat addicted to that behavior, and then you lose control of it. Now, in 1956, the American Medical Association came up with a definition of alcoholism, where they defined it as a disease. And if you go back and look at the actual writings at the time, you will see they didn't really know why they were calling it a disease other than it kind of looked like one. And also the decision was definitely not unanimous. But through brain scans, genetic studies, and what we learned, in 2011, the American Society of Addiction Medicine put out a new definition of addiction, and they've now defined it as a chronic brain disease, not bad behavior. Behavior is a symptom of a bigger problem. They define addiction as a primary chronic disease of brain reward, motivation, and related circuitry. And the key word here is circuitry. The whole definition is 7 pages long. A couple of the points to pull out of this is that it has to be treated, managed, and monitored over a person's lifetime. We know this. There's no such thing as a cure for addiction. Once those pathways have been established, they don't go away. The idea is to put them into remission. Shut them down, close them off so they don't, but all it will take is another drink or whatever, or another shot, and it'll wake them right back up. We want to put them to sleep. That's our goal. As a chronic disease, periods of relapse are a common feature of addiction, but return to drug use is not inevitable. The key words here, everybody knows is a relapse and treatment disease, but the key words are chronic disease. If we start thinking of addiction as a chronic disease, then we put it into the same categories as diabetes, hypertension, and so on. If we treat it that way, we will be far more effective than treating it as a behavior problem. In addiction, there's significant impairment of executive function that manifests itself in problems with perception, learning, impulse control, compulsion, and judgment. So if you're expecting somebody to suddenly become rational and responsible like that, it's not going to happen by definition. If we start to look at the differences between a chronic disease and bad behavior and how we approach those, a chronic disease, we focus on health. We would focus on fixing the brain, which is actually what we're doing now, versus maintaining order and controlling behavior. We talk about when someone has a diet, comes into the hospital for diabetic, insulin problems, we say they've had a recurrence of their symptoms. We don't say they had a relapse. Diabetes is treated by health professionals, not legal agents. Not that legal agencies don't have a major role to play, and they do. Again, that's more in part 2. But we treat people with chronic illnesses with understanding and compassion. but we treat people with substance use disorders with contempt and blame. I mean, you look at the difference between like diabetes and substance use disorders. I mean, we would never call a diabetic, a sugar freak or, carb whore. But look at the wonderful names we have for people that have substance use disorders, crackhead and so on. I mean, even the word addict is derogatory. Diabetes is not a habit. It is not sugar abuse. We don't say if you get high sugar in a diabetic's urine, we don't consider that to be a dirty urine. You wouldn't say a diabetic shouldn't be on medication. And if somebody has recurrence of their diabetic symptoms, we don't call that a treatment failure. And we certainly don't say you get one treatment and that's it. One strike and you're out. We go back and we look at what it is that we need to do. I know we're running over. Just give me a couple more minutes because I got one more pretty much major point to make. You look at how people think. And the person who has the problem is, they want to get better. They understand there's a problem, but yet they're driven to continue this behavior that they don't want to do. Well, let's look at how a human brain thinks. We look at brains from the simplest brain, like a fish brain, to the most complex brain, which is a human brain. And what we understand is that you just, in the evolution of the brain, that you just keep adding parts. So you start with a fish brain, and if you just add a couple parts to that, we have an amphibian brain. You add a couple parts to that, we have a reptile brain. Add parts to that, we have a bird brain. A bird brain has all the parts of the other animals, but has a couple more. You keep going. Possum brain, cat brain, dog brain, monkey brain, human brain. It is not the size of the brain that determines the intelligence of a species. It's how many parts does it have. But what's important is all of these parts within our brain are still functioning. And we can break the brain into all kinds of layers because we still have a fish brain that still operates. But for our purposes of understanding, I want to break it into two. On top of your brainstem, about the size of your fist, is a fully functioning, intact squirrel brain. Your squirrel brain simply wants what it wants when it wants it. It doesn't understand future. It doesn't understand consequences. It does not understand the impact of its behavior on other little woodland creatures. It's not evil. It's a squirrel. And we have a squirrel brain inside of our heads. Our squirrel brain wants to run, wants to hit, wants to scream, wants to laugh, wants to play. People talk about having an inner child. What we really have is an inner squirrel, to be honest. But human beings have a second brain. We have a prefrontal cortex. This does understand future consequences, morality, right and wrong, and future and goal setting. These two brains, while they're connected, are somewhat independent of each other, and they are usually opposed to each other. My existence as a civilized animal basically goes like this. I won. You can't have that. God, I like to calm down. Man, it's a nice day. I got work to do. No, we're going to go sit and listen to the psychologist. Two brains are constantly in conflict. The adaptation of the brain is really occurring in the limbic system, in the squirrel brain. The battle for recovery then is between the executive brain and the squirrel brain. It's not the person and a family member, the person, the PO, the person and an employer. It is between this brain, and that is where the battle is completely won or lost. There's nothing wrong with this brain. It's getting this brain in control of that brain. The last thing I want to leave you with before we take a break is about adolescence. There are two primary developmental periods in the human brain. The first one comes in those first years of life when you're learning coordination and speech. The second one sets in about age 13 and runs to about age 26. During that time, there is explosive growth in the prefrontal cortex. Anything an adolescent is doing at that time is something they're going to adapt to 5 times faster than if they start then at any other time of their life. So if they start using as an adolescent, you're going to get addicted 5 times faster than you would if that same person started at age 21, let alone age 26. Also, people that start using the teenagers have poorly developed prefrontal cortex. That part of their brain that tells them, don't do that, don't say that, show up, is weak. Now, the good news is once you stop using that, it begins to catch up. Is that going to catch up in a week? Certainly not. But we've seen it will start to catch up. This is probably the most chilling statistic of all. Of all the people with addiction, 96.5% started substance use before the age of 21. And I can verify that. There's a drug that is not usually considered a drug in this category. And you've heard of gateway drugs, a drug that you take and it primes you for addiction and leads you to other drugs. There's only one really verified gateway drug at this point in time, and that's nicotine. Nicotine chemically primes the brain for addiction. So if you see an adolescent smoking cigarettes or vaping with a nicotine solution, you should be very concerned because this person is getting set up for major problems later in life. Okay, I know I've gone over my time. I'll stop there and turn it back over to folks, and then we'll join back together here shortly.
All right. Well, we are going to take a 5-minute break at this point in time, and then we're going to come back and have a bit of team time.